Totally flutter-free phacoemulsification surgery by double irrigation tube technique by Dr. Mukesh Dolakia, India. No financial interest. Anterior chamber fluctuation is the greatest enemy of successful phacoemulsification surgery, and its consequences are very well known. It occurs while removing the phaco handpiece and irrigating cannula out of the anterior chamber at various stages of phacoemulsification surgery. To prevent this, one well-known way is to inject the viscoelastic all the time before we remove irrigating cannula or phaco handpiece out of the anterior chamber. But still, some AC fluctuation do occur. We have done an innovative idea of double irrigation tube phaco technique. How it made? Irrigation tube is cut after the pinch valve and a T is attached to make two irrigating tubes as shown in the photo. How it works? Last piece of the nucleus is emulsified and chopper is removed from the anterior chamber. Before we remove phaco needle out of anterior chamber, second irrigating cannula is inserted from the side port to do cortical cleanup. Half of the cortex is cleaned up and we need to do exchange of the cannulas. Before we remove first irrigating cannula, second irrigating cannula is inserted from other side port and cortical cleanup is completed. During all the process of phacoemulsification, AC remains deep and totally flutter-free by our double irrigation tube phaco technique. Assistant managing the tubes and cannulas. Last piece of the nucleus is emulsified and before we remove the phaco tip out of the anterior chamber, irrigating cannula is inserted from the side port. Pinch valve is made by using cap of viscose cannula. Assistant disengages the aspiration tube to attach the aspiration cannula. Irrigation aspiration is proceeded. Assistant prepares the second irrigating cannula by attaching it to second irrigating tube. Before we remove the first irrigating cannula out of the anterior chamber, second irrigating cannula is inserted. Exchange of the cannulas are done and cortical cleanup is completed. Management of posterior polar cataract. Incision, CCC and hydro procedures are completed. Because the nucleus is very soft, we manage this patient by doing only irrigation and aspiration. Posterior subcapsular cataractous plaque is lifted safely without damaging the posterior capsule. To maintain deep and flutter-free anterior chamber, second irrigating cannula is inserted from the second side port before we remove the first one. epinucleus and cortex are cleaned up safely without posterior capsular tear or disturbing the vitreous. Very dense posterior polar cataract with pre-existing posterior capsular defect. This patient was having pre-existing posterior capsular defect, but we could manage this patient well by our double irrigation tube phaco technique. And in the bag IOL was implanted safely. Very dense posterior polar cataract with pre-existing very big posterior capsular defect. Second eye of the same patient was managed by double irrigation tube technique. There is a very big 180-degree posterior capsular defect. As we could maintain deep and flutter-free anterior chamber, anterior vitreous phase remains intact. IOL was implanted into the sulcus as the capsular bag was not intact. Thank you. Thank you very much.